Hi, this is Dr. Vincent again. Let's talk about what makes somebody a good candidate for LDI, because people ask a lot, am I a good candidate? So I had another video describing all the different conditions we can treat. If you have an obvious allergy to something, then you're an obvious candidate right there. If you have a named autoimmune disorder that's pretty clear, then you're a good candidate. If you have some chronic inflammatory condition that may not even have a diagnosis, nobody's given you an effective label, or they've tried to give you lots of different labels and no one knows what's wrong with you. I get a lot of those patients, and if you've failed a lot of other treatments, or it's harder for people to figure out what's wrong with you, a lot of those people do end up responding to LDI. It's just complicated, and a lot of other doctors don't realize that there's an immunological reaction causing the condition. So the more mysterious the problem is, sometimes those lend themselves to treatment with LDI too. If you have something that seems like a chronic infectious condition that just won't go away, you treat it temporarily with antimicrobial of some kind and it gets better, but then it keeps coming back, like a yeast infection or staph infections or bladder infections, these things that just won't go away. A lot of times those have evolved into an immune response condition, and that's something we can often treat, like interstitial cystitis, for example, or things like that. We have good success with those things. If your condition seemed to be brought on by any immunologically stimulating event, then it's very likely to be an immune-related cause of your chronic symptoms. And that could be COVID. Like, we had a lot of people that got sick after having COVID, new immunological or chronic symptoms that they didn't have before. After women have a baby, a lot of times after women have a baby, they will develop new immune response problems that they never had before, whether it's an allergy to something, chemical sensitivity, some autoimmune disorder, or just unexplained symptoms they didn't have before. A lot of times that's an immunological stimulus. That hormone swing is a common catalytic event that sets women off onto a new immune response problem. If you had a vaccination and then the thing started, or if you got a course of antibiotics and then your problem started, or if you had some just really intense psychological stress or distress and then your problems began, those are all things that tend to kick off immunological reaction patterns. So those are kind of predictor things that help us determine this sounds immune. If immunological things influence your symptoms, so if you take antibiotics, let's say, thinking you have Lyme disease, for example, and your symptoms get better, but then they come back when you stop it, like that's evidence that maybe this is helping, or this would help. If you have noticed that your symptoms change significantly when you get sick, like some kind of acute viral illness, that would suggest that your chronic symptoms might be immune related too, because something accentuating the immune response is accentuating your symptoms. So those things are kind of clues. One area I'll mention specifically is autism spectrum disorders. We have limited success treating kids with autism spectrum issues, but when it does work, it's like magic. And so those kids, again, if they had a regression, like they were normal at birth and neurotypical and hit their developmental milestones, but then something happened and they regressed, that often indicates that there was an immunological shift that's behind it. If they get sick, like some kids with autism, when they get sick with a viral illness and they have a fever, their autistic symptoms virtually disappear. And that's stark and dramatic to the parents, and that's another indicator that immunological factors play a role in that kid's autism. A lot of kids with autism, this doesn't seem to work, but those are some predictors that maybe it will. If they take anti-inflammatories or immune modulating drugs and things get better, that's an indicator. Like if you took steroids, for example, for some condition that people thought might be inflammatory and your symptoms got tremendously better taking steroids like prednisone, that's an indicator that there's an immunological component underlying your symptoms. So those are some things to think about as to whether or not this might work for me and I might be a good candidate. Do I have an allergy that's obvious? Do I have an autoimmune disorder that's obvious? Or do I have some chronic symptoms that kind of fit these other descriptors? Those are things to think about. And if you're not sure, just email us or get on the Facebook page and ask some questions and find out if you think you might be a good candidate based on other people's experience.